I have a surprise for you. I don't have a presentation. There is one, but actually what we heard from Dr. Fauzi and our colleague today is covering a lot of things in the presentation, so I would rather share with you some basic thoughts which will lead to more discussions. First of all, thank you very much for all the organizers, for the Saudi German Hospital to host this, and for all those who participated in making this happen. This issue of medical travel is very, very important, and it is the time for it. Why it is the time for it? Because it becomes a fact. Medical travel is here today. It's not something we talk about it in the future. It is something happening every day, everywhere, for all human beings around this globe, for many reasons. Number one, that we do not stop traveling for many reasons. We travel for pleasure, we travel for work, we travel to stay in another country. We travel all the time. So this becomes our nature. The second fact is that diseases has become crossing borders all the time. There is no limits for diseases now. All epidemics has become pandemics, and it's not only communicable diseases, but also non-communicable diseases is traveling all over the globe, and we are suffering as a human beings from the same problems all over the globe. So this has become a fact. Number three, advances in medicine and what happens in the advances of healthcare industry is not the property of one kind of people in a certain country. Advances in medicine is the ownership of the human beings. So when advances happens in Japan or Australia or South Africa or United States or Egypt, it is the property of the human beings. So every progress happens is our progress, and this consequently lead that the human beings should benefit from this. Where this service is geographically located, this is what we are going to talk about. This is very important to know that the world today as a planet has a lot of resources around this globe that we should share, and we understand that this is not limited to the people who live next to it. So having all this said, that we should realize that we have various kinds of people who benefit from medical travel. First of all, when we think about medical travel, we think about maybe tourism. We call it sometimes medical tourism. And this is given the sense that they are tourists who have medical problems. This is true. This is a big category, people traveling for tourism, and they have emergencies, they have medical issues during their tourism, so they have to find this kind of services. So this is a category that we should be prepared. If we are a touristic receiving country, we should be prepared to know what are the risks in our places and what kind of problem they are facing, and we should be ready with this kind of meeting those requirements. The second actually kind of travelers, also travelers who are residing in countries which is not their original country. We have in a country like Egypt, or any country of yours actually, you find maybe hundreds of nationalities living in the same country. Why we consider them medical travels? Because they have different needs, different languages, different cultures, different habits, different disease pattern, maybe also morbidities and comorbidities. So those who are residing in a country, they have also special needs. And the third category, which is very important to address and understand, that there are people who travel specifically to seek medical treatment, medical advice, medical help. They leave their country because for many reasons. Number one, maybe this kind of service is not existing in his or her country. So they are seeking a country where this service is existing. Number two, maybe the service is existed in the country, but there is a very long waiting list. And you all know that in England, or maybe in some other European countries, or even in the United States, there is very long queues, maybe a year or two, in order to receive some sort of a medical treatment or surgical treatment, especially for elective cases. So this means that people travel also to seek not to wait for certain, for a longer period. People travel because the insurance does not pay this kind of service, and they would like to seek the same quality of service in a country, in a place where they can afford it and they pay less. This is another reason people will travel to a place to seek this service. For all those reasons, people plan a medical travel. And this is something that people will think about where to go. And here they are thinking about four things. People who plan their travel, first of all, they are thinking about the quality of care they are receiving in the country they are heading to. And the quality of care here means that they will receive that quality that will yield the results and the outcome that they are looking for. They are not coming or traveling all the way to get no results or to get bad results. So the first thing is the high quality that will lead to the desired outcome expected by the patient. Number two is safety. Nobody will travel to any place unless they secure safety. That this is a place they wouldn't be harmed, they wouldn't hurt, or they will get another problem other than the one originally they are planning to receive treatment for. Number three is efficiency, is money, how much this will cost them. There is additional cost here. It's not only the cost of the operation or cost of the hospital, but the cost of the travel, the cost of the living of the family, the cost of being in another country. So the total cost is a big factor they will think about. Number four, they will think about the patient-centered care. Patient-centered care here means a lot of things my colleagues has addressed. For example, if I am Arabic-speaking person and I am going to China, what do you expect? What do you expect? I don't understand Chinese. Everybody around me is speaking their own language. I don't know what they are talking about. You know, this is very serious. So unless the language barrier is dealt with, unless the nutrition that Dr. Fauzi addressed, that people really are seeking patterns, different patterns of nutrition, so we have to be sensitive to this. Life habits, daily habits, sleeping habits. There's a lot of issues that the culture, different cultures need to deal with. So if we are really preparing to receive different cultures, different people, we need to understand and be culturally sensitive to all those variables in order to be able to manage those international patient and international travel. These are some important factors to consider when we are preparing for to receive medical travel. Now, the reason I am here addressing actually and stressing is the issue of accreditation and how accreditation is linked to medical travel and how it builds this trust that the patient is looking for. Patients, they don't know the details of the medical service. Patient actually is looking at the outcome, the result, but they don't know what are the details of the service. Accreditation here is as external evaluation as we define it, as we know it. It is a set of standards that hospitals and facilities should implement completely in order to pass this accreditation and to get this designation that they are accredited. The accreditation means compliance with the standards, And this is, especially if it is international accreditation, mean that covering all those international needs. So this gives some kind of relief to the patient, to the customer, to the recipients of the service, that this hospital, this facility, this place has passed all the requirements for quality and safety, and consequently it builds this trust. Definitely the combination, for example, of GAHAR, TMOS accreditation that we developed, it combined both all the fundamentals, all the requirements for the hospital accreditation, and in addition also all the medical travel and the requirements for those international patients. So when the patient now and those who manage the patient, maybe the insurance companies or the TBAs, they see the result of this accreditation, they trust this is the place where they would like to send the patients in order to make sure that they are safe and receive high quality. The last point, actually, we talk about in this quick presentation is the centers of excellence which follow the accreditation. Accreditation is a very good foundation. Implementing standards is very basic, very important. But what really the patient is seeking is the center of excellence where the patient is going to receive a particular treatment, trusting they're getting the best results. Like when I go to the best place to have cardiac surgery, for example, or knee replacement, or hip replacement, or cosmetic surgery, or name it, whatever the reason, ophthalmology, dental. Now, I should know that this center is characterized by being an excellent, by implementing the best guideline, the protocol, they have the competent staff, they follow the rules and guidelines every time, and they have designation also of a center of excellence. And by the way, GAHAR is working now on developing standards for excellence, and these will be over and above accreditation, and this is going to be a very helpful tool and designation for hospitals that are going for this kind of designation for medical travel. Advances in technology is very important, and especially I will emphasize also the information technology and the advances in telemedicine. Telemedicine, as my colleague just mentioned, there is always sharing information before and after. Before, we can save a lot of time for those patients instead of coming and doing a lot of work out here, the investigations and all that. A lot of work can be done at your place, and then you send all this, and the diagnosis is confirmed, and then they come on site, they receive the intervention, the procedure, and then the follow-up also. You will be sharing a lot of information later on for follow-up and monitoring, and there should be ability to transfer medical records safely and securely, because if there is dissemination of information in a wrong way, this might be a big legal issue in medical travel. So sharing information is a big responsibility, should be done properly, should not be confused with any other patient, very good ID identification, and all the securities related to telemedicine. By the way, GAHAR is now developing standards for telemedicine in order to complement also the accreditation. For those who would like to work on this area, they should fulfill those requirements for telemedicine. The last point I'm mentioning here is medical tourism is a total industry. It is not only a hospital activity or just a single activity. The whole nation is working together in order to have successful medical tourism industry in their country. It is cooperation between different sectors, starting from the embassies of these countries around the globe that facilitate visa acquired. Medical visas is a requirement. Should be easier and should be facilitated than any other a visa, and this is very important. The travel and transport through airlines also is another very important piece. Receiving at airport and transportation is a very big issue in order to reach to the destination safely. And all the food industries related, all the accommodation related to the families and the companions. And in addition to this, the nice piece that everybody talk about it when medical tourism comes, maybe this family also need to see the country, the entertainment, maybe having some cultural tourism during the stay. This is also should be organized. It is a whole industry, the information industry also, as I mentioned, it is all working together to produce successful medical travel. Thank you very much for listening. I'll be more than happy to answer your questions later. Thank you.
Thank you, Dr. Ashraf, for your presentation.